Hi, everyone. My name is Jillian Parker, and today we're going to discuss how we can keep our kids healthy and active during the winter months as the COVID-19 pandemic continues to impact our communities. We are joined by Dr. Matthew Stevens, who is a pediatrician at Genesee Pediatrics. Dr. Stevens, thanks for joining us today.
Thank you for having me.
Now, snow is coming eventually. We're getting into the winter months. It's getting colder out. Less of an opportunity possibly for kids to be exercising outdoors. Obviously, it's still recommended to be social distancing as the COVID-19 pandemic is still in our community. What are some things that you would recommend for kids in order to keep themselves healthy and moving as we hit this time of the year?
Well, I think that kids should, focus on trying to remain active as much as possible. And it's not as easy as it was in the past. I really encourage children to be what we call solitary activity, meaning, not doing the large groups with people outside of your social bubble activities, but more along the lines of walking around the block, activities with your family. That's something that we really stress. If you can play a game like basketball or soccer or toss a football with your family, even 10, 15 minutes a day, that does make a big difference in the long run. If you have any gym equipment at home, a lot of people have, various equipment at home. Free weights, treadmill obviously is ideal. Not everybody has that, but anything at home that you can use to exercise while everything's going on right now can make a big difference. And it doesn't, need to be a continuous 60 minutes, 75 minutes. The American Academy of Pediatrics does recommend getting that 6 days a week, but you don't need to do all of that with one, activity. So a lot of people get, bogged down by that. I can't do 60, 75 minutes a day of, walking around the block or, one activity. It can get mind numbing, and we appreciate that. I say try to do 10, 15 minutes a day of one activity at a time. So, split it up. And, even something small like a jump rope, or doing sit-ups or push-ups, calisthenics that you can do can keep you active and can keep you healthy.
Now, what are the dangers of screen time? I know a lot of kids revert to this, especially as you do get into the colder months, and making sure that your kids are breaking up that screen time with other activities, like you've mentioned.
Yeah, well, screen time is something that is a twofold thing. So first of all, it's something that can, decrease your ability to do things like activity, like we were discussing, keeping yourself outdoors, social. And the other side of screen time is it's not great for your eyes. It's not great for your developing brain. You don't want to be staring at a screen for too long over the course of a day. Now, this is very idealistic with the reality that there's a lot of homeschooling going on right now. We do say that from 2 to 6 years old, no more than an hour a day of screen time, between TV, phone, and computer, and
Mhm.
6 and older, no more than 2 hours a day of screen time between TV, phone, and computer, with obviously right now the exception of school. So that being said, we appreciate that this is extremely difficult to maintain right now. I would encourage, if you find yourself staring at screens all day long, pick up a board game, pick up a book, strike a conversation up, do some of the activities we discussed. But as a whole, it still does have an impact, unfortunately, despite the pandemic. And I know it's a small, potato compared to, the overall picture of what's going on right now. But we do really think it's important to continue focusing on the importance of limiting screen time.
And how does the impact of lack of physical exercise impact young kids? A lot of them are going to school remotely from home, may not be getting up as much, and even if they are, might not be walking around as much as they would if they were inside their school.
Mhm. uh, you know, Not doing activity, it's going to affect the weight. And I've seen it countless patients of mine that have gone up in weight more than they ever have before. And the reality of that is because of the inactivity, more time at home, so you have more time to eat, you know, more time to not move around. Even, it's interesting, even moving around between classes at school seems to have had an effect on, limiting weight gain that we're seeing occur right now. So, the importance of remaining active despite this, can't be overstated. I mean, if the pandemic ends and we're all up 40 pounds, we're going to have a lot of work to do, and we're trying to limit having to go back to that to that level of exercise that'll potentially be needed when this is all said and done.
And a lot of with kids studying remotely, as you mentioned, they are possibly on their screens or staring at a screen more than they might be. How does staring at a screen for a longer period of time, plus a potential lack of exercise, affect a kid's sleep pattern?
So decreased exercise and increased screen time are detrimental to a child's sleep pattern. There's no question about the effect of bright screens on activating, parts of your brain that make it much more difficult to sleep. Combine that with decreased exercise, and you will just simply be more awake at the end of the day. And again, this is something I've seen since the pandemic started. People's entire sleep schedules have changed. Now, part of that is also because of the stress of the pandemic and the fact that, some children just say, you know what, my schedules are so different. I'm going to play video games very, very late at night and wake up early in the morning the next day, and nap somewhere in the middle of the day. And, this is something that, it's not conducive with having classes that are online. It's not a healthy way to keep yourself focused in school. So, it requires a lot of self-discipline, but we are encouraging trying to have the 7 hours of sleep as close to possible as what we had pre-pandemic, because of how important it is to remain focused when we're at school, which is very, very difficult right now while we're doing online learning. And the last thing we need is increased tiredness on top of that.
You've mentioned our patterns being off in so many different ways. Our daily lives have changed. And we talk about mental health a lot. How is it that a disruption in your normal schedule can affect children's mental health? And are there certain things that parents can be keeping an eye out for, paying attention to see if their kid might be suffering from that?
Well, there's a lot of different signs of mental health changes during the pandemic, which is unfortunately also something that we have seen. A lot of children are aware of what's going on. They're very stressed out about what's going on. Some don't know how to express it. Different ages give you different abilities to express this. And we do find that younger children do have a little bit more difficulty expressing what they're feeling. So, you want to look for things like, increased fatigue, okay? Decreased interest in activities that children previously were interested in. So that can be a little more subtle, but if you see that your child, loved even virtually talking to your friends or playing board games with the family, and all of a sudden isn't doing that as much, that's something to, be aware of. Sometimes you can just see a mood change. They don't seem as happy as they did in the past. Diet changes. There's, a whole host of signs to look for. And then, how to address it. I would recommend reaching out to your local pediatrician about this. There's a lot of different mental health resources in the community. Our clinic offers, connections with, many, many mental health resources in the community. We have Genesee Mental Health, which is on the bottom floor of our clinic, but there's a lot of different, psychologists, psychiatrists in town, which can provide help. And a lot of people, are apprehensive about starting something like this. But the reality is the most important thing that can help somebody through this can sometimes be a professional with an objective opinion to be able to provide some feedback to somebody going through this, and just giving the ability of somebody to express their feelings right now. So if that's needed, it's needed.
And we've talked about a lot of different activities kids can do to keep themselves engaged off of screens. You mentioned the mental health component of it. Holidays are approaching. What are some healthy daily habits to help keep your kids on track as maybe their normal routine is not so normal anymore?
The answer to that question is there are a few activities. Some people, believe it or not, some people are getting into online dance videos. They're called Go Noodle videos, TikTok. Just even doing 10, 15 minutes walking up and down the stairs, if you have a 2-level apartment or house where you could just, give yourself an opportunity to move. Push-ups, sit-ups. I even find myself doing that much more than I have in the past, because it's just a very simple way to keep yourself active in this difficult type of environment. Some parents are into yoga. I'm fine getting kids involved with that. If that's, I really encourage parents that are physically active and doing activity on their own to incorporate, their children into it, see if they can get them to be active while they're active. Some exercise equipment is simply not appropriate for older children, but, you can still find ways to incorporate them, making it a family activity. Exercising is something that's something I would encourage.
Do you have any other tips or words of advice based on, some of the things that you've been hearing and seeing from both parents and their kids over the last couple of months?
I mean, I think it's very important to have an open dialogue with your family right now, more so than you ever had in the past. I find that the children that are very stressed about this aren't always open with their family. And I think that, it's difficult for some families to have that real conversation. How is the pandemic affecting you? Are you able to do things that you've wanted to do in the past, and are there ways that we can try to make that happen right now, even though it's not necessarily as easy as it was in the past? I mean, some people are apprehensive to doing virtual options as opposed to in-person options, but when you do the virtual options, you actually find that it's not as terrible as you envisioned it to be. And in those instances, I would encourage to be as proactive as possible to make people's lack of ability to complete certain tasks happen. Some people can't hang out with friends. You do virtual hangouts, and then when they do it, they're like, oh, good, I can see my friends. So, the best answer I have for that is please be open with your children. Please have an open dialogue with your children right now, because it's very, very important that you know what it is that they're feeling.
If that dialogue is not open and kids are not able to appropriately express how they are feeling, talk about the impact there if they are bottling some of those things up.
I mean, it's going to come out in a lot of different ways. It could be temper tantrums, could becoming socially isolated, could become depression. We spoke about signs of that before, but not being able to communicate your feelings affects all different areas of your life. And for some people, they need to speak to people, unfortunately, outside of their household. And the only way to make that happen is with virtual hangout sessions. Zoom exists. That's why we're doing this right now. And I think it's worth considering outside of just these types of arenas, but having friends hang out with each other over it, it's something. And, after months and months of this, it gives people an opportunity to see each other.
Some great tips and advice from you, Dr. Stevens, today. Is there anything else that you wanted to add that we haven't touched on here today?
Please get the flu vaccine. It's really all I can say about that, but please get the flu vaccine. It's our best shot of preventing any further illness right now. And, it's not something that we should delay on.
Since you brought it up, is there concern based off what you're hearing and seeing in terms of volume? Maybe people or parents afraid to get their kids the vaccination this year?
There's always a group of parents that have concerns, and I appreciate that there are some parents that it's always good to question. It's always good to ask questions to your doctor, and I completely understand that. What I told parents, and I do feel this way, is that whatever your concerns are, come forward to us with it. We'll talk to you about it. And we can discuss it. We can, but we need to have an open dialogue, much like you must have with your family. I think it's important to have with your pediatrician as well. But this year, like every year, there are some people that still don't want to get it, and we really are discouraging that as much as possible this year. If there's ever a year for an exception, this is it.
Dr. Stevens, thank you so much. I really appreciate your time today.
Thank you. You have a good day.
You too.